Joining us is Brianna Walvoort, and I would like to bring you up to the stage so that we can have a great conversation about the topic that I opened up this talk with tonight, which was cesarean section and the care that's provided with those individuals very soon after giving birth, after having a pelvic surgery. And so to give your amazing work, it's due attention. I do want to just, say to the audience, please feel free to chime in the chat if you have any questions that you'd like to ask Dr. Walvoort tonight, because we will be getting into some pretty personal details of her own story and journey as a two-time C-section mom, as she's called herself. One was unplanned, the other was planned, and also her journey where in the midst of the pandemic, and we'll kind of get down to the nitty-gritty of what date that was, what time of year, but in the midst of the pandemic, she worked with a team in her hospital to pioneer a program that sees all C-section moms in her level 2 trauma center. And she now recently has added OT services, or her hospital has added OT services to see those moms immediately after cesarean section surgery. So from developing the idea to getting the program running under a month is what her team was able to do, under 30 days. And personally, that's the fastest that I've heard of a program starting to see a population where we know now cesarean section is the most commonly performed surgery in the United States, well over knee replacements and hip replacements. And so 3 years later, it's still running. Thank you, Brianna. Thank you so much for joining us. How are you?
Great. I'm really excited to talk about this. I always, whenever people ask about my C-section and my program, I'm like, okay, do you need the 30-second elevator spiel, or do you need the Brianna is really excited about this program and I could talk for an hour type of a spiel? So it's nice to actually have this, because now I'll be able to tell people, oh, you want the long version? Like, here, this is exactly what it is.
Absolutely. I want to talk about one thing I did say in the video that I just played, because a lot of people are a little confused as to, well, if the mission is to get everyone an OT or PT in the hospital after birth, after C-section, like you did, and I want to learn more about your program. Well, why do you say that you don't need to be a provider or have a degree? And so I want to kind of give a little background on that statement and then just have a real conversation about your thoughts on that. But coming into this work, I actually learned a lot about what doulas did. And you and I both know, to be a doula, you don't need to be a doctor, right? You don't even have to have a degree, but yet doulas, I've been following certain doula agencies and groups and individuals who have pioneered programs where everyone receives access to a doula who didn't have one before in their hospital systems. And these are providers, to me, providers of information, providers of access to care, and they don't make decisions for that person, but they're able to connect people with resources more immediately than sometimes our healthcare teams. And so when I made this video, I was very well aware that, yes, I'm trying to bring OTs and PTs to be doing what you're doing, which I want to go in and just dig into your hospital and just learn a little bit more about how you did it so fast. But then I also want to do a call to action for anyone who's not an OT or PT. We know the struggles that we have in terms of reimbursement, productivity, making sure we're seeing other patient populations. But there are people in the community that know how to really bring resources to that person. And those are also individuals that we can lean on to support the cesarean section population a lot more than they're being supported. So let's talk a little bit about your journey. Will you tell us a little bit about your unplanned cesarean section that started all of this?
Yeah, so I have 2 little boys. One will be 4 in August. So August of 2019. Oh, and then my other one just turned 1 in January. So like 16 months. So August 2019 was when I had my first unplanned C-section. And we went into the delivery, being a medical person, I was like, all right, let's talk through the hard stuff. Like, what happens if they say I have to have a C-section? No, I want to try without an epidural, but what happens if I do? We talked through all that. We talked through do I save myself or the baby? We purposely like went into all the super hard stuff, because then going into the whole delivery, we were like, all right, we've got a plan. My husband would know if she's unconscious, I know exactly what we would want to do. So I felt like that typical mom who gets sent home. My water broke, or not my water broke. I started contractions at like 6 o'clock on a Saturday morning, and they were about 5 minutes apart, and I was strep B positive. So I was like, okay, let's go in. That's what they tell you to do. And I was like a 3. And so I got sent home. I was like, oh, okay, so we can do this. And labor progressed by like 6 o'clock that night. I was down to, I think they were like a minute and a half, 2 minutes apart. And I'm like, all right, we're going in. And got in. I was like a 5. They said, okay, we'll keep you. You're in labor. And the wonderful doctor who was on her way off shift was like, oh, you want an epidural? Well, you're like, yes, let's get you your epidural. We can get that for you, on her way out. So I was like, thank you very much. And it wasn't that bad of a labor. It was pretty not typical, but with the epidural, I was doing okay. But then as the night progressed, because my son was born at 4:30 something in the morning, every hour they checked me, something was wrong or not how it should be. So one of the hours they broke my water and there was meconium. Then one of the next one, I was 2 a 7. Then they checked and I was starting to spike a fever. Then his heart rate was decels. Then they checked and I was a 9. And then the next hour I was back down to a 7. And I'm like, wait a second, like I'm supposed to be getting bigger. And it was just all these little things that every hour something was like, okay, here's another thing. Okay, here's another thing. I felt contractions through my epidural. I was like, I feel like I should push, but I'm only a 7, so I'm not going to push. And when they finally came in the one time, you can tell they, didn't know I was a medical provider, which was totally fine, because they were like, okay, here's what's happened. Here's what's going on. We think a C-section might be the best idea. And I was like, okay, where do I sign? Like, I'm ready. We've had enough go wrong. Let's just get him out. And they're like, oh, you don't need to think about it. I was like, nope, we talked this over. Like, get that anesthesiologist in here. Let's get this kid out of me. And so brought me back to the OR. When they rolled me on my back, his heart rate dropped, and my heart rate, I hear his going down on one monitor. I hear mine going up on the monitor behind me. And so they like rolled me on my side. They're like, hey, we'll give you this betadine splash. So I had it all the way up to here. And then we're like, the instant the doctor comes in from catching that baby, we're going to get him out. And so it was roll me back, incision. My husband said they had your incision open by the time I walked the short distance in there. And he came out, he was 9 pounds, 8 ounces. So his head was like the movie Coneheads, or the TV show Coneheads. He had this really nice cone shape. So I'm sitting here holding my baby. I'm like, he's so cute, but look at his head. And they're like, okay, well, this is the reason you gave birth to a toddler-sized child. His head would not have fit. So it was not a traumatic for me, at least, but one of those where it's just like, okay, this wasn't what I had planned, but I was okay with it because I had talked it through. However, my brain was like, PT, you're a PT? No, we don't remember how to move. So I was texting my coworker who had just had a C-section a few months ago. And I'm like, how do I get out of bed? I know I teach this every day. I just was teaching this 2 days ago. Tell me what I need to know. Like, I wasn't planning on this. So what are the things you've learned? What are the movement tricks you've had? I was just scrolling through my text messages this morning with a coworker, and I pulled it up, and it was like this long of scrolling in my phone of all the information. So my coworker, Becky, fantastic. She gave me all of this stuff, and she's like, it might be a lot, but here's what you need to know. And that I latched onto that. I held on to that. I'm like, this thing is fantastic. I'm never going to delete this. I know I sent it on to a few other friends who had C-sections. I'm like, here's what Becky told me. You should read this. So that's kind of where, yeah.
Whoa, wait. I have to ask, do you remember, and you might even, because you looked at the text messages, do you remember if you were in the hospital asking that?
Oh, I called her while I was in the hospital.
You were in the hospital.
So I delivered at 4 something on a Sunday morning, and it was probably 10 o'clock Sunday when I was, texting all my coworkers, like, hey, I had a baby, texting friends, and then texted her, hey, we're C-section twins. Like, we used to bump our bellies when we were pregnant. I was like, we can bump our incisions now. And yeah, so I ended up calling her. I was looking at the text and she's like, oh, sorry, I had to hang up. I was like, that's okay. They were giving me a shot. She's like, well, if you want more info, let me know. I was like, absolutely. She's like, all right, here it goes. And just sent all of that stuff to me. So yeah, not even a few hours after giving birth, I was telling people, how do I move? What do I need to know? Like, I want to make sure I'm prepared. Because I didn't in my brain too realize most our hospital C-sections stay 2 days, but I was mentally like, oh, 1 day, then you're gone. So then I was like, when am I going home? I'm just gonna figure this all out now so I know what I need to do.
Okay, so that's really great for me to hear because we just had a conversation offline after one of these webinars that we've did. This is the third and final one for May. And the conversation had to do with the idea that adding OT and PT services in the hospital after birth, even C-section, is going to be overwhelming to moms. Too much information. You just showed me how much information was given to you in text, right? So
Yeah.
just like take that text and whatever was given to you, had somebody been in your room and shown you, or actually like broken each step or done all of that. Now that you're on the other side of it, it's hard to like actually like not be biased. But do you think in that moment that would have been like welcomed open doors had someone just automatically been a part of your team to go over that information?
I mean, I would have loved it because, it's like you go into mom mode when you have a kid. It's like everything else that you thought of, yes, my coworker said log roll. Okay, I know how to log roll. So all that I had to be told was log roll. But it's still like those reminders of things. And what I tell patients now with our program is you'd probably figure out the best way to get in and out of bed, but you'd probably do it painfully 10 times. Now I'm telling you how to do it so you can do it right the first time. And I like just the little things too, those things that it's like, I wouldn't think of that. Oh my gosh, I wouldn't think of that. Oh my gosh. Like I'm looking back at her text and it was things like, hey, watch where your seatbelt is. It's going to hit at your incision, telling me about night sweats, telling me about like positioning for feeding, because now you have an incision, all those little things that you just think I'm a mom, it's going to come naturally. And now you're like, yes, I'm a mom, but oh, by the way, hey, that kind of hurts. Like my abs aren't working right now. How do I do all these things that I thought would just be an easy thing to do?
Okay, so I want to just go over that short list. In 2019, you had an unplanned C-section. You obviously, I mean, I think we can even say you had a life-saving C-section, potentially for you and your baby. You avoided an even more traumatic experience. And at that time, your colleague sent you a list that went over how to get out of bed, seatbelt, which I had never, like, you just kind of like opened my eyes to that, just where the seatbelt is placed. And if there's like barriers, so anyone who's in the audience, like, what are we going to talk about? Taking notes. Positioning for feeding. And what was the other one?
There was a lot like, hey, make sure you go to the bathroom before you feed your kid, because once you're sitting, you're not going to want to back up. Talking about how to poop, like, hey, you have to have a bowel movement. Well, here's a better way to do it than straining, teaching me the log roll. What was the other one? Oh, then just talking about some of the more medical, like night sweats and like, yeah, when your milk comes in and this is how you should sit. And when you shower, think of doing this.
Okay, so question for you, because this is often a conversation that we get into. So if nurses are in the room or if they're listening to this later and they're like, well, we cover all of that. From your experience, you've now had 2 C-sections. What really is the difference between what an OB nurse would cover and what an OT or PT would do?
The biggest difference for me was the nurses are there to take care of you in that moment. So they show you the things. Like I can remember from my second C-section, that night nurse, because the day nurses all knew me. The night nurses didn't. She's like, all right, when you stand up, lean forward, nose over toes. I'm like, hey, that's what I would tell myself. So they teach you those movements in that moment. And they might tell you, hey, make sure you try this for home. But with therapy, we're really focusing on the home. Like what I tell my patients sometimes, practice that log roll while you're here. Keep using the up and down bed because that's great. Like it's nice to be able to come up and lay down with a bed when you're fresh after a C-section. But here's what you need to do for home. That's our big prep is I tell every mom, my biggest thing that makes me happy is if a mom later tells me I went home and I wasn't scared. Like I looked at my bed, it's like, hey, I know how to do you. I don't have to worry about that. And, I saw my walk-in tub shower or my tub shower, and I knew how to step over that. Just those things that could really give someone apprehension and make people nervous. And which is when we get to it, the mom that helped me start this program, that was exactly what she asked. So it's just like, what to do for home. Now you're prepared for home.
Okay. So great segue because you said the mom that helped you start this program.
Yes.
Is this a mom who's a patient or a mom who's a coworker?
So I have one patient who asked for us, and it all kind of stemmed from that. So she, in the middle of, I'm just going to jump into her program. So July of 2020, our relatively empty hospital, thanks to COVID, which I say as much as COVID was horrible, I don't know if we could have started this in 30 days without COVID because we were like, all right, let's see people twice a day. Let's make sure let's see more people. We were trying to make sure that we could see all of our patients, but also we just didn't have a very full hospital at that time. So a mom told her nurse, I want physical therapy. I want to learn how to get in and out of bed and how to do stairs. And I luckily was the therapist that took that because I was like, hey, I had a C-section. I could teach you some of this stuff. As I'm in the room with her, I'm teaching her how to log roll, kind of talking through stairs. And it was just like this epiphany. And I'm like, we should really be teaching everybody how to do this. And her response was, you don't teach everybody how to do this? I'm like, no, but oh my gosh, we need to be doing this. So I'm getting all ramped up. And when I get excited, I see some of my coworkers are on here. They could probably tell you, I talk really fast. I get really jumpy. I kind of do this. And so I was getting so excited during her session. And so got done with her. She was like, hey, I feel great. I feel excited, like not excited to go home, but I know how to do this now. Like this is exactly what I needed. And whether you call it a godsend, whether you call it serendipity, whatever you want to call it, I walk out of the room, the physician assistant for the floor is standing right there. Also, fun fact, the room that this patient was in is the room that I was in when I had my kid. So this one room on our floor, I'm like, this is where the stuff happens. Walk out, the PA is there. And I'm like, hey, I have this really cool idea. Like we should see these C-section moms. And she was like, that sounds like a great idea. You need to talk to our patient care supervisors. As she's saying that, they walk around the corner. She's like, those two right there. Those are the people you need to talk to. It's like, okay, walk over to them. Hey, I have this great idea. And they were like, oh my gosh, why haven't we been doing this? Like, yes, absolutely. Let's do it. So I was like, great. I'm going to go talk to my manager now and go down and talk to my manager, Allison. I'm like, hey, I have this really good idea. There's something we think we should do. And she was like, we've got the time, we've got the resources, let's do it. And I was like, great. Also, by the way, my coworker Rachel is going to help me. So I have to really call out my coworker Rachel Ethan, who's on her maternity leave now, so couldn't join me with stuff. But I volunteered her. I was like, Rachel's going to help me. I haven't talked to her yet, but she is an acute care therapist with me and then also had started doing outpatient pelvic floor therapy. So in my brain, I'm like, I know the having a C-section side and she knows the beginnings of that pelvic floor side. Because if you would have said, hey, what's pelvic floor PT? At that point, I would have been Kegels. Kegels, sure. I didn't know much beyond it. So told my manager and Allison was like, yes, let's figure it out. Like, I like this idea. Let's problem solve. Let's figure it out. And so then went and found Rachel. I was like, Rachel, here's what I want to do. She's like, yeah, that's a great idea. I absolutely want to join you. So it was just this cascade of events that happened over the course of, it feels like a really long time, but it was probably just like 1 or 2 hours where everything just fell perfectly into place. And from the start of that idea, Rachel and I started gathering information of like, okay, what do we want this to look like? What do we want it to involve? What do we want to tell people? We started a Google Doc where we were writing down things. One really cool part for me was I joined a bunch of Facebook mom groups and posted in all of these, like, what do you wish you would have known if you had a C-section? Or what do you wish someone would have told you? And I just pulled it out the other day. I had 7 pages, single spaced, of answers from people of all the things that they were like, Bed, someone told me to tie a rope to the end of my bed and pull myself up. That was a stupid idea. I tried log rolling. Or, how do I get it on and off the toilet? How do I get in and out of my pickup truck? Am I supposed to use that abdominal grinder? All these things that moms just like cascaded in for me. I just remember refreshing, and writing everything down. And so we came up with a bit of a template of, okay, here's what we think we want this to look like. And then 2 weeks later, we went and presented to like one of the nurses' meetings of kind of like the ones who were overseeing some things like our quality control. And we were like, hey, here's what we think this should look like. Here's our idea. It's 2 weeks, it's fresh. And they were like, yes, like there was a few nurses that have been working there for years that were like, why haven't we been doing this for 30 plus years? Like, we're teaching these moms this and we want to teach them this, but sometimes we don't have the time when we have, even if you have 2 patients on a labor delivery floor, that's technically 4. So it's just like, we need that education. And so we're like, yes, let's do it. Oh, we need to tell the OBs. Okay, we're going to start it in 2 weeks. And so talk to the OBs. Everybody was on board because they were like, oh, it's nothing different. And at our hospital, it's kind of included in that lump cost. So that was one question was, are these moms going to have to pay for it? And from our standpoint, it was nice to be able to say, no, it's just an included thing. So idea was around July 4, and we started it, I think, August 5, which was like 2 days after a day after my son's birthday.
So I want to like take a pause to kind of just like revisit that and engage our audience a little bit, because what Brianna, what you said and really what you showed, first of all, your enthusiasm and your passion, it was just quite, I hate to say contagious, but that's the word I'm going to choose to use. Like, it was completely infectious. I'm just going to just put all of the words that we were told not to use 3 years ago. It to me is inspiring because I still have therapists that are struggling with building their programs and getting buy-in and all of that. And you came from having had your own experience to then having that opportunity to work with a mom and then actually like have her show you how surprised that this care she was receiving wasn't just standard. And that like turned on this cascade of events to where it's almost like all you had to do was speak. You didn't tell me that you had to look up a lot of research articles that proved PT was beneficial after C-section, and then take those research articles to the OB and do this big presentation to the administrators. No, you listen to what a person needed, how they benefited, the experience that they had, and you essentially created a service line, a business in less than 30 days.
Yep.
In your hospital system that didn't cost the patient anything.
Yeah, that was a very big part. I know that was the questions I was getting asked early on was, okay, what cost is this going to be? What cost is this going to be? And I even know, like with my first one, I turned down integrative med because I'm like, I don't want to have to pay my medical brain. I don't want to have to pay for another service, and learning all these things like, hey, our acupuncturist is free. Our massage therapist is free. Our physical therapy is free. Like, that was just so nice to be able to tell people, no, it's not an additional charge. And the nurses weren't concerned about that at all.
Brianna, I want to give the audience a little bit of just backstory, because how do we know each other? We don't. You've never taken, I mean, there's no secret. I teach a course that teaches acute care therapists to do what you did. You've never taken that course. You and I were working in a hospital doing the same thing essentially. It took me 6 months. So when you said 30 days, I'm like, you're coming on. You're coming on this day, this time. I want you to tell your story, because that to me was like unheard of. But we are in the same Facebook group, and you reached out to me because I made a post wanting to kind of broadcast to the public. I've made no secret of this, get to the public the way that you did, actually get the information out to the public and let them come into the hospital asking for OTs and PTs. And that's not easy to do because hospitals, as you and I both know, are not broadcasting that they offer OT and PT services. Big problem. How do you get that information out to the public to say, if you're having birth in the hospital, here are the providers you want on your team, when you don't even know if the hospital you're giving birth in actually offers those services or not? And so why ask for something when you're going to be turned down? Because there's no one in the hospital that's comfortable enough to see you. They feel like maternity care is so different than any other patient population that they're equipped to see. And so I want to ask, for you, in terms of this, our backstory, okay? In terms of that, I would like you to kind of tell the audience who probably are mostly OTs or PTs. Maybe there's some moms here. Maybe there's some non-provider professionals, health and wellness, doulas. If you could do it all over again, what would have been your biggest advice for someone just like starting out? What would be like the number one, piece of information they should have collected at the beginning?
I think for me, one nice thing was I kind of went into it slightly blind. And I think my just excitement and momentum really helped because it was one of those, I wasn't at that beginning taking time to be like, I have this idea. Oh, now should I really do this idea? Okay, let me think through the whole process. Should I do this? I just jumped. And, right now we're trying to bring it to other hospitals. It's sad, not sadly, that happy COVID's done, but now that our hospitals are full again, it's taking a little bit more time to get some of that traction. But I just didn't have any fear of asking people things. And like, I can talk about it in a while of how we got spiritual care involved. And that was the exact same thing. We were like, here's an idea. Oh, look, you're spiritual care. Let's do this.
I want to
Like,
hear about spiritual care and OT.
yeah,
I mean,
yes.
spiritual care, we don't even think about that. What was the scenario that kind of like started that?
Well, and I want to back up and say one more thing. So, the other thing I wanted to call out that really helped was one of those patient care supervisors was so on board with us. She was getting her doctor of nurse practitioner and actually took our program on for part of her research. So
Wow.
getting one or two key people to be at least your touch points so you're not bouncing around between different people. But this nurse, her name is Beth DeRong, I have to call her out. She adopted us in. She was like, this is great. She did a ton of research. She actually presented to all of their nurses at a skills day in the fall and had a session about what we do with PT to make sure the nurses knew what was going on, and used I don't even fully understand all the research she was doing because I was reading through it and I'm like, my PT brain can't understand some of your nurse brain stuff. But that was a huge help, was to have someone who was also helping spearhead it from the medical side of, we're doing the therapy work. We're telling them, here's what we need from you guys for nursing. We're calling the charges and saying, we need you to put the order in, and they're doing it. But then she's also getting that education in for all the nurses. So that was another big, super helpful thing for us, was getting that one or two people that you're like, here's my one touch point that can help with all of that.
You had a champion on the inside,
I did, yes.
outside of your field. So you answered kind of partly the question is like, what was the one thing? And it was it's beyond communication. I talk a lot about communicating your value. No, you actually were able to pull someone outside of your field to explain what you did in the way that it would bring other people on board who were decision makers in your hospital.
Mm-hmm. And it also helped, her education got the night staff and the evening staff who we would never have a chance to interact with. And they all did those skills days. So we had people then, our hospital were color coded. So like therapy wears royal blue. So then I had some evening people, if I was there till like 4:30, being like, you're the therapy person. We're like, yep, that's us. You're starting to see our notes. So that was just great to get that touch for everybody to know who we were.
Okay, so spiritual care and OT. And by the way, I'm an open door when it comes to, if you have someone in the audience that you like to tag and bring on stage to give a little bit more background on OT services in your hospital, now is the time, because I would love to focus on just the differences between PT and OT. I just feel like if we can do that, nail that down, maybe that can like really help people to take that back to their hospital systems and with confidence be able to communicate that to other disciplines. But let's start with spiritual care, and maybe we'll have some people join us for the occupational therapy section. So how did you get spiritual care on board in your hospital for moms after birth?
So spiritual. Oh, I also want to quick. I see Beth is on. So hi, Beth. I see a few of my coworkers are on. So spiritual care. We had noticed because therapy, we're spending a significant amount of time with people in one setting. Like, the nurses are doing things and they're in and out the whole day. But for us, we are spending like 20 to 30 to 40, 50, 60, depending on how intense the moms need us. We're spending all that time with them. And Rachel and I and my other coworker, Tori, we started noticing we're kind of those sounding boards. Like we're getting a lot of that. This is not what I wanted. Like I was planning on doing without an epidural. I was going to power through this. I was going to have a nice natural birth. And then my baby's heart rate started dropping and they ran in and wheeled me out. Or, I've been in labor, they induced me and I've been in labor for 48 hours. And we were just kind of getting some of that, just that like, this is disappointment or like even birth trauma. I know that's a new phrase that people have started talking about, but we were sounding a lot of that. And so I went and talked to Rachel again and was like, what can we do for this? Like, there's got to be some better option, whether it's in acute care, outside, like outpatient, something. And I was like, do we talk to social work? And then we have a really good relationship with one of our spiritual care providers. She's actually the mother-in-law of one of our therapists. And Rachel was like, what about spiritual care? Like, that's what they do? They go and talk to people who aren't planning to be in these situations. So she emailed our spiritual care lady. And then like 2 days later, I was on the floor again, talking to the same PA. And I was like, we had this idea. And Rachel talked to spiritual care and sounded like they were on board. And as I'm talking about it, our spiritual care person walks around the corner again. And I'm like, her. So I called her over and she was like, this is what we're here for. Like we are underutilized within the hospital because we're not in the hospital as a spiritual care of, whatever religion you are. We're more here to be that this is not what you had planned, whether it's you had a huge back surgery because you like fell off a tree or you have a new cancer diagnosis, that whole range of any diagnoses, that's what they're there to do and to help with. And she was like, we get consulted for the losses and for the tough situations, but we're not getting consulted as much as we probably could on the postpartum floor. And we were like, okay, what do you need us to, what do we have to do from your standpoint? Do we have to work anything around? And they're like, we just put in the order. And like within our hospital system, it's not something that has to be co-signed by the doctor. So we can just put in a spiritual care consult, and we started doing it. So we now
PTs, I just want to get this straight. OTs and PTs can put in an order for a spiritual care, representative to come to a mom who's just, had a traumatic experience from their standpoint, whatever that looks like for them.
Mm-hmm. Yeah. And I know different hospitals have different things because I know some of the presentations I know I've listened to, it's like, oh, we bill because we can put it under outpatient. Mm-hmm. So every system might be different. And like with our hospital, we need that co-signed order for the therapy services to come in. Sure. But like social work and spiritual care in our hospital are something that we can consult, that we don't need that co-sign. So it's now coming directly from us. And we told the nurses, we're like, you don't have to do anything. We just want you to know. Don't even tell the patients because, as a new mom, if your nurse came in and said, so spiritual care is going to see you, you'd be like, what's wrong? Like, why? Something wrong with me? Something wrong with my baby? Mm-hmm. And so the spiritual care people are like, we're just going to walk in and say, hey, I hear this isn't what you had planned. Do you want to chat about it? And our spiritual care providers, the two that I've talked to, are both joking, like, we have a lot of people are like, no, I'm fine. And 30 minutes later, they're still telling you all of the stuff that's going on. So They have just become that sounding board. And every time I run into them, I even ran into one of them again today. They're just like, some of these, they're okay. They don't need us. Like, they're just like, no, I'm good. I've got this great family support. Others, we've had such in-depth conversations that have really helped them process through it and help them realize, like, yeah, this isn't what I wanted, but my baby is here. And this is what I'm going to deal with now. And it's been so nice to have.
All right, let's talk then about OTs, because there are some in the audience. Some probably are actually providing these services at their hospitals. Like, you just added OT services now to your service line. So is there anyone that you'd like to invite up and if there's no pressure, but if you want to start kind of talking about how that came to be, I really want people to understand and have a distinction between OT and PT services in the hospital after birth.
Yeah. So I checked with my OT and she just wasn't able, timing wasn't quite right. She's like, I'm going to listen to you, but I'm still running all over. So, we, just added in one OT because we were having a few days with like vacations, leaves of absences, where all of a sudden we were like, oh my gosh, we have 6 C-sections today, and there's no PT to cover this floor. And in our brain, we were always just like, mobility, PT. But then we also have therapists, PTs, and OTs that treat lymphedema in our hospital. And that's a bilateral, like by either service, PT can do it, OT can do it. And so when we had like 2 or 3 of these days in a row, I'm like, there's got to be something we can do. Like we've trained a bunch of our like float staff. We have a decent amount of therapists that are trained on mom baby, but it was just that one day of the week that we were not having anyone there. And so I scrolled through that Facebook group and I was like, what do the OTs do? And I'm like looking through a bunch of the OT posts. I'm like, oh my gosh, everything we do is ADLs, like those activities of daily living. We're training it as the mobility side. We're training you how to stand and sit. OTs are training it as how to get in and out of the shower, how to pick up and carry, doing the same education, but under just a different billing code, it's all the same. So this one took a little bit longer. It wasn't a month, it was 2 months, but we went to my manager and we were like, hey, we're having this day. And, we know now we kind of have a triage list of when the hospital's really busy, we have to bump some things down. So we still provide our handout to everybody, but we really target those first time unplanned C-section moms who are the ones where they're so overwhelmed. We could, like, thinking of myself with my second one, my therapist visited me and just were like, we're going to chat with you because you know what to do. But I still had them give me the handout. I'm like, I just need the reminders. But we had a lot of unplanned moms. And so we're like, we could train OT to do this. And so my OT looked up the OT Practice Act, was so excited when I told her my idea. She's like, I can do this. We could do this, is in our act. We could actually do this. And so the two of us together and Rachel and Tori, I pulled our kind of main people in, kind of like laid it all out, sent us up to our manager. We chatted about it with like some of the upper level supervisors, because that was the other thing, is our supervisors have asked, and you get those questions like, well, why do we need to keep seeing these moms? Which, if you're an outside perspective, you might be like, oh, well, you're a 20 or 30-year-old person. Like, you're moving well. You had a natural thing happen, not a C-section, but delivering a kid. So why do you need therapy? And then going through the education of like, and using myself, it's an unplanned, huge abdominal 7-layer surgery. You lose your abs. Well, they're there, but they're split and brought back together. We need someone to teach these people how to move. And I've given that education to so many people within hospital systems, friends and family. And it's just like, it takes a little bit to click. And then, I say, okay, well, we're seeing some younger people post-abdominal surgery or post-spine surgery. This is the same thing, but just because they're on a different floor, it's like we kind of sometimes forget that they're there. So got everything kind of straightened away. And just last week, Tuesday, pulled in my OT and I was like, hey, we can train you. I just got the okay. And from that day, it was a pretty easy train because she's also had 2 kids herself, the one OT that we're training. And so she just read through the book and basically, I feel like, had it all memorized. It was like, I know what to do. You just got to show me how to type these notes.
So she knew what to do because, one, she's a licensed professional and just knows, just seeing someone, activities of daily living that she could actually teach them and intervene like she would any other population. So you didn't have to actually tell her what she could do as an OT. That's not the type of training that we're talking about. It was just introducing her to the population, the way that you structured your notes, and then looking at the handout, which is this book that your team created. I know you can't go through it, but I'm just like wondering, everyone gets this book of interventions day one.
Yeah, so it talks through, so we see them, so like we see them on day one, not on their surgical day, because at our hospital they're there for 2 days, and it goes through all that basic mobility technique. But instead of saying like bed mobility, log roll, sit to stand, nose over toes, we really spelled it out. And that was one big thing we realized early on when we were making it. We're like, yeah, we'll develop a handout. And then as Rachel and I started typing it, we're like, okay, well, what if we have these moms whose babies are down in our special care? We have like a level 2, we have a NICU down on our first floor.
Uh-huh.
So what if these moms are having to go back and forth so we can't catch them because they're always downstairs, or they're zonked out every time because we have a rule that you will not wake a sleeping mom, and especially not right after baby. So we were like, we need a little bit more detail, because also we're going through stuff. Like if I would talk my normal, like kind of almost memorized routine, but if I would talk all the way through it, it's about 25 to 30 minutes of information without questions. I don't expect myself to remember that much information. So I don't expect these moms to. So we touch on all of it and then provide this handout that has everything spelled out front to back, where you could forget it all and go back and read that book and it would be those reminders.
Okay, Brian, I have to have a question
Yeah,
before so did you have that within the first 30 days?
we had a version of it. I go back and read that version. I'm like,
You had a version of this
oh,
instruction and this instruction manual that you basically created with your team. You had a version of it within the first 30 days. You guys had quickly put your minds together
put
and
it
created.
together so fast. I'm looking back through it, and it ended up being like a 9-page booklet that talked on all the mobility stuff, but also our really important things that we added and why we advocate for seeing repeats is we have scar desensitization, scar mobilization, and pelvic floor PT. And those were things that I'm like, these are important, because even talking, we have a lot of coworkers that have had C-sections, and we have some that are like, I still can't feel my incision. And like, I teach people desensitization. I didn't do it to myself. Or
Mhm.
scar mobilizations, and moms talking about how they get that tucked look to their incision. And like, people don't realize that's something that you can actually work on. And if you can't fix it yourself, that's something that pelvic floor PT can help with, which after my second one, I went to pelvic floor PT because I'm like,
How long
I'm telling you
afterwards?
to do it. Yeah,
How long
what?
afterwards?
I got my order at my 6th week and I went at 8 weeks.
At eight
And
weeks. Yeah.
mhm. And I started, because I started my own scar mobs, and there was a spot that I'm like, that's stuck, and I can't figure it out. And I was like, something else has got to be wrong. And I went, and the thing that blew my mind away the most was she was like, all right, lay on the bed. Okay, now try to sit up. It's like, that's fine. And I tried to sit up and I couldn't even roll my shoulders off the bed, because I had, with both boys, they grew straight. So I had such bad diastasis recti that I was like, I have no ab strength. And then, of course, the first question is, okay, could you do a sit up before? I'm like, yes, I could do a sit up. So I didn't realize I need to strengthen my abs. And I also didn't realize when we did the internal pelvic floor exam, my left side was super tight. And I have had hip and knee issues for years. I played college sports and I've always had issues on my left side. And I was like, okay, if I wouldn't have gone to PT, I wouldn't have known how this stuff is going to contribute to other issues.
So now do you have a direct referral to outpatient pelvic health from the
So
hospital?
we give it as an option, because since
Mhm.
it's still something a lot of moms just don't, they're like, no, I don't think I'm going to need that. So we talk through what it should be. And we can, within our system, we can put in outpatient orders within the hospital. So like, we'll do it for stroke patients as well. We can put in that order that the doctor signs. So if they want it, we can put it in. And I always say it as a, then you don't have to remember, because our central scheduling calls you. And I've been getting more upticks in that a little bit lately, because we were kind of offering it, but it at least gives them that idea of, oh, if ABC isn't going well, I can call about it.
Brianna, I want to just close out with this. I want to thank you, first of all, so much. One, for sharing your personal story. Two, for like just giving us the nitty gritty of how you got started with this program. I'm floored. I'm so excited. I'm hoping that, people who watch this later on will just be inspired that it can be done. There's a process. Every hospital is different, but you find the thing that works. And it sounds like you did a lot of just talking, of opening doors. And lucky you, a lot of them just stayed open and just like allowed the floodgates to happen. But you pulled together a team, and in the amount of time that I mean, people can't really fathom, especially the ones who have been working on this for years. But I want to, and I say years, I mean like years. People have told me that they've been working on starting a program I had one therapist tell me it's been over 5 years. And, I came on the scene and I've kind of like really have just been added, in terms of like, well, let's even get into the universities at this point and start training our graduates, before they graduate, about this population so that there's equity in care. But you're just quite remarkable in what you did. And then, so I have to just end with this. We connected because you, again, called me out on a directory I was trying to form. And we started talking about some of the roadblocks that I was finding. And that's with publishing information about what services hospitals provide that are not known to the public, to their own communities. And so for me, as the Pelvic Health Network, to publish that a hospital offers OT and PT services after birth, it was actually a little bit more trickier than I thought. But after your talk tonight in your interview, I know going forward, we'll talk more offline, but I would love to partner with you and work with you on making a directory that people can access around the country of the services that are available to them in their communities before they go to the hospital after birth. And I think that we could probably do that and pull together something and maybe
That'd be
get around.
great.
I think so. I mean, the information that you have, again, is proprietary to your hospital, but the information is here. It's
Right.
here, right?
Well, and the other big thing is like, as fun, not fun, as cool as it is kind of be like, hey, I don't think I said it early on, I'm working in a suburb of Minneapolis. So as far as I know, we're the only hospital in Minneapolis that does this. And it's like a nice draw for our hospital currently to be able to broadcast that. But also it's so sad to be like, we're the only hospital that does this. And so I'm hoping like by being able to get out and this lovely serendipity way of how we connected, like if that can get out to other hospitals, even if it's just getting the word out that if your hospital doesn't offer it as a mom, you maybe can ask for it. You might have some roadblocks, but if you push through some stuff, you might be able to get that PT to come and see you. And that might be the start that another hospital needs, just like what I was able to get.
Absolutely. I would like to end with this. We have the admin of the Facebook group that we're a part of in the audience. If she doesn't mind, I would love Dr. Erin Licati to come up to the stage just to end with us, Brianna, because if so, we might be able to rope her in with at least getting this directory, at least getting the information of, what hospitals right now, even in your community, want to start a service. If you wouldn't mind even taking on a role of being the point person in your community, I think that the way to do this is to provide more access and touch points for the public to just get information about what this is, what are the benefits, and that's something that they can even come into their hospital asking. And when people want something, it is an incredibly powerful tool. You saw this with the mom that started this all, Brianna. If people want something and are shocked that it's not being offered to them, that's the most powerful tool that I've used to start programs in hospitals I don't even work for. So, Dr. Licati, if you're in the audience and you're just be willing to just kind of talk to us a little bit, I'm going to pull you up just to end. So, Erin, you're the admin of what group?
It's OB, PT, and OT,
Mhm.
obstetric physical therapy and occupational therapy on Facebook.
Yeah.
But it was started by Ann Krogan, who's a PT out of Colorado, who is an OG in this space, right? She has
Yeah.
right started a program at her hospital and is just incredibly generous with her time and with sharing resources. So there's a Google Drive associated with the Facebook group that has research articles, handouts people have shared. It's a really great group so that you don't have to reinvent the wheel for every single piece of doing this program, right? Because it can feel overwhelming when you're like, wait, I need a handout for this and I need a handout for that. And,
So true.
oh, I need a research article for this. It can feel like a lot to do all by
Exactly.
yourself. So the group is really amazing.
And Erin, so in terms of just like getting people just comfortable, like what do you have in the works to just like say to acute care therapists who are like, whoa, pelvic health, maternity care, this whole conversation has made me even twice as much uncomfortable. I don't know if I even want to go there. This is just a little overwhelming. Brianna, you've done so much in the past 3 years, but I'm an acute care OTPT. I don't know if I could see this population. Erin, what resources do you have for those acute care therapists?
Yeah, I've definitely gotten that feedback myself from hospitals that I've worked at, other acute care therapists, that they just really don't feel comfortable going in to see this population, and they're concerned about even experience, though they're experienced acute care therapists, that they're just not confident, and they're worried that they're going to maybe hurt somebody or miss something important that they should have seen. So, they don't want to go in and accidentally do harm to somebody or miss something important. So within my hospital systems, right, I've been doing in-services to train other therapists, but that's really slow, right? That's me doing one hospital at a time that I work at. So I've been over the last year putting together a course that's going to come out on June 17th through Rebecca's Public Health Network that is geared towards people who are acute care therapists who want to work with this population, but feel like they're just not comfortable. We didn't learn anything about this in school. So it's designed to kind of be a crash course in the basics you need to be confident to go in and see this population. So it is not as advanced or detailed as the ERAD course that Rebecca's offers. So her ERAD course is like the gold standard course, or maybe it's the only course. It's amazing. But it's 15 hours, I believe, right? And it is expensive. So for an acute care therapist who, I want to get into this population, but I'm not in a place where I can invest that kind of time and money in a continuing education course, or maybe an acute care therapist who, this is not my passion area, but my hospital is starting to add on postpartum services, and I'm expected to be able to go see these patients if they end up on my schedule. So I want to feel comfortable seeing them. But again, it's not my passion area, so I'm not going to probably invest the kind of time and money that the full ERAD course is. This is designed to kind of be like ERAD light. So it's on sale right now for $200. It's 4 hours long. So it's a much condensed version. It's really just to get you like the basics you need to be confident and to feel comfortable going in to see somebody.
Okay. And that's June 17th. And that's from 8 to 12.
Yes. Eastern time.
Eastern
8 to 12
time.
Eastern time.
Excellent. I would love to just end with this. If there is a way that we can train the masses, Brianna, you gave so much. I mean, I feel like you gave a webinar tonight. You gave your time, you broke down your program, you taught us like just how it started, the passion that you had, the support that you had from team members that were not OTs and PTs. You were able to justify these services, and they just caught on and it just spread. And so what my goal with this, with supporting therapists, and if there's anyone in the audience, I had someone who had never taken ERAD, and I think that's going to be the goal forward, is that if you are a therapist and you want to start this in your state or in your community, Brianna, you mentioned that in Minneapolis, you're the only hospital system. And
as far as I know,
underserving people. It's not, we talk about underserved communities, but we don't talk enough about how we're underserving people, right? We like to kind of label people as being underserved or rural populations, but we're actually underserving people because we don't have the services that they need. And so if we trained more therapists or got more therapists comfortable, I think that's my goal going forward with the Pelvic Health Network. If you know of people that you can plug into this information so that they feel comfortable enough just teaching the log roll, maybe not teaching pelvic health. We know it'll impact pelvic health because the more they hold their breath and the more they try to, strain against that incision, that puts them at risk for more problems that can impact their pelvic health. So the mindset is teach them the log roll. Teach them the log roll. If that's your comfort zone and you're not comfortable around pelvic health diagnoses and all of that, and all the things that we know down the road would help someone, if you're comfortable as an acute care therapist to teach someone the basics, just teach them the basics. And so
that's what I tell people too, like, because we have a decent amount of therapists that we've trained who haven't had kids, who were like, I can't do this. Or when I have students with me, they're like, I can't go up there. I'm like, okay, you know how to treat an abdominal surgery, right? How do you teach them to get out of bed? How do you teach them to do this? And they're like, oh yeah, I know that. I'm like, it's an abdominal surgery. It's nothing new or like inventing the wheel. You're just losing some abdominal mass, if you want to put it that way. You're all of a sudden just putting it back to those kind of basics you learn in school, a lot of my students have actually latched onto it and they're like, I've got this. I mean, I've got one of my therapists who was a student and now works with us. And she said that she's like, learning it as a student, I knew how to do it because I know how to treat those patients. So that's what I always tell people. If they're like, I can't do this, I'm like, don't think of it as a C-section. Think of it as an abdominal surgery, and that can get you started. And then, like me, you'll learn more than just what a Kegel is. You know, you can dive into that, but that at least gets you that groundwork to start in.
Absolutely. All right, you two, if you could leave our audience with one thing that would inspire them to just do a little bit more for this population, what would it be? Brianna.
My big thing is be excited about it, because from my experience and the short time you guys have met me, you can probably tell I just get really invested. And I think that has made such a big difference. I know my manager has said with some of the other programs we've started, when they're like, this is your passion, let's do it. If you can show people, I'm excited about this. I don't know how it'll work, but this is how I want to help improve healthcare. A lot of times people are much more receptive to that than to just, hey, I've got an idea. Hey, I think we should do this. It's going to take longer because people don't realize how important it is. And whether it's you who've had a C-section or a family member, sometimes bringing in some type of personal experience to be like, that person didn't know what to do. Let's prepare them to do it. That I feel like has helped with a lot of my jump starting of the things that we've been able to do.
I would say talk to people about what it is that you do and what therapy can offer this population. I found that a lot of people just don't know, and not only patients, but also other providers. OBs, postpartum nursing, really had no idea what physical therapy does in the hospital. Their perception of physical therapy was thinking about outpatient PT, and that gave rise to some misconceptions about what we might be doing with patients coming in to see them postpartum. So just talk to as many people as you can. And there were some people in the chat talking about other providers in their hospital, like postpartum doulas or lactation consultants, and just building relationships with those people and letting them know, because the more people that know that you exist and what you can do to help people, the more people there are to advocate for this. So just keep talking to people at your hospital, in your community, volunteer to go teach some classes at a local birth center or a postpartum support group. Like, the more that people know, the more people can ask for it.
And I'll echo what Brianna said to end, is join as many groups, like Erin just said, in your community and get down to the nitty gritty of what people are asking. And I'll tell you this, and I'll give everyone a hint in the audience today. If there is a question that comes up more than 2 times, if it's asked twice or more, create a course, create education, create material for it. Erin is right. ERAD is 15 hours of content that is so overwhelming to take at one time. So if someone is asking the same type of question, what do I do after C-section? How do I reduce my pain? How do I, prevent, my abdominal muscles from being separated permanently, whatever it is. And they're asking that in these groups, create some type of education material, because this is one of the most amazing opportunities, is to extend your practice to serve women, especially after birth or pelvic surgery. One of the most, I would say, popular populations. Abdominal surgery is not going away. C-section is the most common surgery performed in the United States, even around the world. So if you can create a piece of education that serves this community, you will expand your practice faster than you can believe. So thank you so much, Brianna, for your time. Erin, always, thank you so much for coming on and just being amazing. It's been amazing to work with you ever since we met. And so thank you all. And if you have any questions or want to get in touch with these two, Brianna, how can people get in touch with you?
So, Facebook, because if you want, that's how we started it. Otherwise, you can also email. So you can see my name in I think you can see it, but it's my first name. So Brianna Walvoort at gmail.com. And I can answer any questions as best I can and just hopefully help with people.
Excellent. And Erin Licati?
So the same thing, you can find me in the OT and PT OB Facebook group. I am an admin in the group. You can also email me. I'll put my email in the chat as well. And I'll do my best to get back to you.
Awesome.
Sometimes
Well,
I get
thank
a
you.
lot of emails.
Yeah. Thank you everyone for joining us tonight. And thank you too for just coming on and telling your stories.
You're welcome.